Hello, welcome to today's training, which is Chemical Peels 101. This is everything you might possibly need to know with an asterisk in there about chemical peels, okay? This is general information. This is not going to be specific to individual peels. I will get into those at later dates with little shorter videos covering each one of those peels, when you might want to use that specific peel, how deep it goes, and any changes that, any deviations from the information I'm giving you today. We're going to start with a quick refresher on how chemical peels work, when we might want to use them, and the strengths we deal with. I'm going to give you a general chemical peel protocol, but it's a lot of information because I'm going to cover everything from beginning to end. Like before you even think about starting a peel on someone, the ground rules that we need to have in place, all the way to what follow-up is going to look like. And then with that, you will kind of have that basic protocol in place, all that basic information, so that when I do the trainings in the future on the individual peels, you'll be able to have that information kind of lingering in the back of your mind. So if I tell you, oh, this peel you only need to put on for, 8 minutes versus the 10 minutes we generally go for in a general chemical peel, or, this peel we don't rinse off, there are some circumstances of that. You can kind of have that information going on in the back of your head. So let's get started. So to start off with, it's always good to have a basic refresher, but what is a chemical peel? Because the answer might not be quite as direct as you'd think. A chemical peel is a chemical exfoliant. That's basically what a chemical peel is. Any chemical exfoliant is going to increase cellular turnover rate and cause peeling on a microscopic level. So technically, a chemical peel and a chemical exfoliant are one and the same. This is where things get tricky, right? Because when most people think chemical peel, they think of like that episode of Sex and the City. This might be aging me, but whatever, it's fine. They think of that episode of Sex and the City where Samantha goes and gets a chemical peel. She comes back and she is beet red and like sheds all of her skin like a snake. Well, now we have more and more manufacturers creating chemical peels for like daily or weekly use that are diluted enough to be used at home. And some estheticians are in a tizzy because they're like, you can't use a chemical peel at home. Well, yes, you can, because a chemical peel is just a chemical exfoliant. But to make things easier, we're going to use a working definition for inside our office that tends to be what most society goes with, which is, we consider a chemical peel to be a chemical exfoliant that is strong enough that only a licensed professional can purchase and apply it. Typically, this means, depending on the manufacturer, that can start at about 12 to 15%, sometimes even 10, depending on the acid blend, and goes up to about 30% for estheticians. That tends to be, it's one of the few guidelines that tends to be universal across all of the US. There are some instances where we can and do go higher. Because we are in a medical setting, we have that bit of leeway, right? Normally, if they need to go above 30%, we send them to the aesthetic RN. There are a couple exceptions to this though, and we will get into those in those individual trainings. But don't be worried. Those are pretty intense peels. They're your usual run-of-the-mill peel client. Most of the peels you do are going to be somewhere within the 20 to 25% range, which is what we consider medium to deep, medium deep depth. You'll have a lot of clients who can't tolerate that, and they'll need a lighter peel. And we have some light medium peels that fit within the context of a dedicated chemical peel service like this protocol. For people who need lighter than that, 9 times out of 10, anything we just do in our normal dermaplaning facial will be just fine for them. They probably won't need all that much, and we'll get more into those details later on. The main things we're trying to treat with a chemical peel, really 4 main things: aging, acne, texture, and hyperpigmentation. So aging, all of these kind of relate to one another, okay? Aging, we're typically dealing with some texture and we're typically dealing with some hyperpigmentation, but there's a caveat here because we're also dealing with thinning skin. So we're trying to help stimulate that collagen production, which we can do with increased cellular turnover. That's how retinoids work. And there are a lot of peels that utilize retinoids in order to make that happen. So aging is kind of a blend of issues. Acne is, again, another blend of issues. You have texture. A lot of times there's both scarring and raised areas where obviously the acne is, and hyperpigmentation. The inflammation that comes with acne tends to lead to pigmented scarring, the two of which together means it's not so fun. But you also have the added issue of typically very, very increased sebum production. You got to get that under control, as well as the texture and the hyperpigmentation. Sometimes you will have aging issues and acne issues in the same client, and so you are literally just trying to treat everything on the block. I am one of those clients. Super fun. But we will get into kind of what you would use for strange circumstances like that, when you can utilize and kind of tinker with the different peels and their strengths to suit certain issues that you might not necessarily stereotypically use that peel for. But just keep in mind, when we're using a peel, we're typically treating aging, acne, texture, and pigmentation. Now, before we even think about doing a chemical peel, there are a few ground rules that we need to lay down. This is going to protect everyone, okay? It's going to ensure this. Anyway, it's going to ensure the success of the peel so that there aren't going to be any weird, funky after effects, or any likelihood of that is at least greatly diminished. It's going to protect the client and ensure their happiness. It's going to ensure you as an esthetician are protected, that you are doing your due diligence in making sure that this is the right treatment for them. It's obviously also going to protect the business because, you know, we don't want to be handing out peels left and right, right? Like, yes, of course, in theory, we could be just doing a 20% TCA peel on anybody who walks through these doors. Now, that would, of course, be wasteful at best, right? And permanently damaging at worst, okay? If you are just doing chemical peels left, right, up, and down, again, not the like daily grade or very gentle grade, the things that we would use to like prep the skin for dermaplaning, for instance, those are fine, okay? But if you are doing what we consider a proper chemical peel on just any Tom, Dick, and Harry who walks in here, that's not going to be good, okay? There are several things we need to consider, okay? How many times have you seen them? Full disclosure, we absolutely will not, under any circumstance, do a peel on someone that we have not seen before, okay? Absolutely not. Not gonna do it. It is not good for you as an esthetician to get into the practice of that. I know many do. We're not gonna do that. Okay. It's not good to get in the habit of that as business people, right? We want to make sure that we know their skin before doing something as intensive as a professional peel. And it's not good for the client because it lets them think they can just walk in and get anything done, not realizing we care about them and their skin more than that, okay? Don't let a client pressure you, bully you, intimidate you, anything into doing a peel on them. Really, that goes for any service that you think is not suitable for them, but do not let them. They will try. You will have some clients who try. If that happens, let me know, let Heather know, let Allie know. We will intervene for you. If they are giving you that hard of a time where you feel like, whoa, I don't even want to engage with this anymore, not a problem. You let us know, okay? We've only had like 2 of those that I can think of, but don't let them bully you, don't let them pressure you. Just explain that it is your job as a licensed professional to make sure this is the right treatment for them and that their skin is going to handle it the right way, okay? And that means seeing us for at least 1 facial first, preferably a dermaplaning facial, okay? And when we get to the general peel protocol, you will understand why. But we need at least 1 facial, again, very preferably level 2, to see how they might react. Even then, if you're still on the fence, say, you know what, I think we might need to see you for a couple more just to make sure that your skin can handle this. You might need to make some changes to their home care to prepare them for this. There are all kinds of things that might need to happen before you can even think about going the chemical peel route. Be honest with your client about that, okay? Don't make them feel like you're dragging them along, but just say, look, I want to preserve the integrity of your skin. I want to make sure that we're doing this the right way and not in a way that could actually backfire and cause more damage to your skin. Honestly, a couple dermaplaning facials might end up being all they need because our facials are way more potent and effective than the vast majority of other spas and salons, especially in this area, okay? We've had a lot of clients convinced when they come in that they need microneedling and chemical peels, this, that, and the other, when really all they needed was to come see us every, 4, 6, 8 weeks, make some changes to their home care, and boom, suddenly their problem's fixed. And then they can, bump out to seeing every 8 weeks just on a maintenance phase, okay? We have had that happen more times than I can count. Now, if you have been treating the same client with the same problems for 3 to 4 visits, and they're all 4 to 8 weeks apart, closer to 4 to 6 if you can do that, with little to no improvement, it might be time to look into a chemical peel, okay? That goes for new, old, what have you, okay? At that point, the skin is telling you, yeah, this is gonna take more than just our facials, even though we don't do like the traditional run-of-the-mill facial. It says that it's gonna need something even more potent than our normal facials. Another indicator is a regular client who's been coming to us for years and years, and their treatment's just like stagnating, or when you're finishing up with their treatment, you're noticing their skin doesn't quite have the same vitality that it normally does. When people walk out of our facials, they just have a glow, okay? Normally there's a little bit of pinkness, possibly some redness, depending on what exfoliant we used, but they have got this glow that lasts for days, if not a week or more after. If you're not quite getting that glow out of it, it might be time to look into a chemical peel. And when we talk about the individual peels, we can kind of talk about what peels might be really good for that particular circumstance. But just a couple areas where it normally is a strong indicator, a chemical peel is probably right for them. Next, Do they have any contraindications? Now, there are a lot of different contraindications that keep you from having them entirely. And then there are some that don't necessarily keep you from having it entirely, but you as the practitioner might need to do a little bit of mental math to make sure that it suits them perfectly, okay? The big ones, of course, that keep you from having it are pregnancy and breastfeeding. A lot of these are just way too aggressive for that hormonal skin. We'll want to wait until probably 6 months out from when they're done breastfeeding to do a chemical peel, because the hormones can keep fluctuating in their skin for that long after. Now, if their skin has been about the same for about a month, you know, they've gone through the hormonal purging, sensitization, all of that, and things have been the same for about a month, that's a pretty good indicator that, yeah, okay, you can start it. Normally that doesn't happen until the 3-month mark at earliest, 6-month mark at latest. If they have taken Accutane in the last 6 months, can't do it. The one exception is if Dr. Florentino or any of the PAs on the dermatology side sign off on it. Normally they will not sign off on it until the 6-month mark. So that is, you know, I don't anticipate that happening, but if it does, there will be multiple notes on their chart, on their appointment when they book, okay? Normally they will finish their appointment on the derm side and circle right around to our side and go ahead and book that appointment. And explain to Allie in detail, or whoever's at the front desk, they'll explain in detail what's going on. We can confirm it with the dermatology side. You are covered in that case, okay? Normally that doesn't happen though. If they are having an active rosacea or psoriasis flare-up, don't do it. Don't do it. It's gonna make things worse. There are some people who, like, let's say they've got some psoriasis on their arm or their leg that's actively flaring up and they want to get a chemical peel on their face, request a doctor's note first. You can always request a doctor's note and have it be just fine. Especially if they're a patient on the derm side, they'll be more than happy to be like, yeah, no, they're good, they're fine, or yeah, no, we did not sign off on that. They can't do that right now. When in doubt, especially if they're a patient on the derm side, you can ask, and they'll let you know what's actually up. If they have any active cold sores, obviously that keeps them from getting any facial treatment, or are prone to cold sores. Because of how a chemical peel works and the amount of stress you are doing to the skin, you are doing controlled damage. That is how cellular turnover works. Example, like this cut on my arm that I have no idea how it got there, right? The collagenesis process is going to mend this cut, create new healthy skin to heal this up, right? That is how we get a chemical peel, microchanneling, really any of those more intensive treatments to do what they do, is we stimulate collagen production and cellular turnover by doing controlled damage, okay? When you are doing damage like that, even if it's damage in quotations because it's getting us the results we want, you have a massively increased likelihood of cold sore production. Now, you will have some patients who are on antivirals and retrovirals, this, that, and the other, and they're like, I haven't had a cold sore in 15 years. In all likelihood, you can do a chemical peel on them. Start very gently, but in all likelihood, they're going to be okay. If they are not, they will let you know. Trust me. If they are like, you look at me funny and I get a cold sore, don't bother. Don't do it. Just, you're going to have to go a little differently in their home care. It can be done. It's going to be much more of a marathon, but you can make their skincare goals still work for them. If they are prone to keloids or excessive scar tissue, don't do it. Again, we are doing controlled damage, right? If you are prone to keloids or excessive scar tissue, there's a chance that we could actually create more scarring, or in some very rare, bizarre circumstances, you could end up making someone's entire face one giant keloid. Obviously, that is not what we want to do. So if they have a history of those things, it's not going to be in the cards for them. They could scar very, very badly. If they've had recent cosmetic surgery, or if they have had laser or peels that weren't done in our office, okay? If they've had laser, normally that's done on the derm side. If they've had laser or any kind of peels done in our office, we can look up the time frame. We can talk with, I think it's normally Tracy who does lasers. We can talk with Tracy or whoever did the last peel. Make sure that the time frame is good for the particular peel that you want to do. Because sometimes they will try and scoot in a couple weeks sooner than they should. Don't let them. Make sure their skin is healed enough to do the peel that you want to do. Now, there are some things that need to be discussed with the provider, but don't necessarily keep you from getting a peel. Things like permanent cosmetics. You have to wait at least 7 days from when you got them, and make sure you use an occlusive no matter how old the cosmetics are, because otherwise they will fade and like disappear in some cases. Make sure you cover them with occlusive. If you're like, Charlotte, let's say they have permanent eyeliner. Like, Charlotte, it's gonna be nowhere near their eyeliner, they're fine. Put it on anyway. Protect yourself, just put it on anyway, okay? If they have diabetes or any kind of issue with a deficient immune system, it's going to make the healing process take much longer. Now, for some people, it's not too much longer. They're really good about their sunscreen usage. They're going to do all the proper home care routine. They're going to make sure that they do everything they need to do to protect their skin. They'll probably be fine. For some people, it's not going to be fine. And their skin simply will not be able to heal fast enough to make getting a chemical peel worthwhile for them. So unfortunately, it just won't be in the cards. Another issue is high blood pressure. If they have high blood pressure, go gentler. Kind of like with, a lowered immune system, because with high blood pressure, you've got a lot more blood going through the skin. And any kind of stress can aggravate that blood pressure, possibly causing it to spike. We don't want to do anything that might end up hurting them or might end up accidentally with a trip to the ER, okay? For most people, it's not really an issue, but you've got some people where their high blood pressure is really, really dangerous. Another issue is blood thinners. They're on aspirin, Coumadin, warfarin, or any kind of anticoagulant therapy. It doesn't mean they can't get it. It means you have to go on the gentler side, because that blood is thinned out, so it's going to be circulating under the skin much faster, which means that peel is going to go deeper into the skin faster, okay? Start gentler, you can build up. Again, doesn't mean you can't use it, just means you got to be careful. Last thing is connective tissue disorders. You're not going to encounter a ton of these realistically. However, it can actually make your peels not as effective. A lot of times with connective tissue disorders, they have a naturally increased cellular turnover rate, but they have a hard time letting go of those dead skin cells. So a lot of times they're going to be using way more exfoliant than you would normally recommend at home, but it's not really going to do anything to their barrier. In fact, they'll normally have a pretty intact barrier. So you might need to go a little stronger in your peel than you would normally think of, but they also might come across as a little bit more sensitized simply because they tend to flush more. Not sure why that is, they just tend to flush more. Sometimes the capillaries are a little thinner, and so it looks like there's more blood. Just continuously check in with them. Hey, you're looking a little flushed. Are you irritated? Is everything feeling fine with the skin? As long as it's feeling fine, you can keep on going. You're not going to encounter way too many of those, And the only reason I know about it is because I have one. So, we're gonna keep going. Trust me. I know it's a lot of ground rules, but it's important. What time of year is it? I know it seems a little silly, but chemical peel, there's a reason fall is considered chemical peel season, okay? Chemical peels are best done in cooler months when people are more likely to just be hanging out inside rather than outside. Obviously, there can be some exceptions. There's some people who work outdoors year-round. There are some people who travel and do winter sports like skiing, things like that. You'll also have some people like teachers who really the only time they can get a chemical peel is during the summer because they don't want to be peeling during the school year. At least so they think. We do have options for cases like that where they might need a chemical peel for what they're wanting to treat, but they don't necessarily have time for the shedding your skin like a snake aspect. We'll get into those things when we discuss peels, but what are they using, and are they using it consistently? Home care goes so much farther than people realize. Yes, we can do so much in our treatment room, but if they're not following it up with consistent, good home care, it's really not going to do nearly as much as people think. You don't need an 18-step Korean routine. Do not make them think that. We know you don't need that, okay? Don't get me wrong, I love it, but a regular routine is very important. It's going to look different for every person based on lifestyle and budget and what all they've got going on. But in general, we recommend at minimum a cleanser, a toner, a vitamin C serum, a moisturizer, and a sunscreen, okay? If you have those, you're gonna be good. Now, most of our clients will have a bit bigger of a routine than that, but make sure your client is at least using those steps first and that they're geared towards your client's skin type. You will get people who love TikTok and they're just getting recommendations from wherever that's not really suited for their skin. There's no problem with saying, you've got a good basis, but we need to make some tweakments to make sure that this is actually suited for your skin, not just whatever is trendy. It also needs to be used every single day. It's not one of those things where, like, some people will like deep clean their teeth right before going to the dentist, and the dentist is like, I can tell. We can tell that with skincare too. Everybody's seen it. Their routine needs to be used every single day. No matter the day, no matter the weather, no matter how they're feeling, it's got to be used every single day. If they're fickle about sunscreen usage, you'll need to ensure that they will use it in the weeks leading up to their peel, during the healing process, and it's important to keep using it afterwards. That's where a lot of chemical peels go wrong, is they won't use it leading up to it. They'll use it during the healing process, and then they're really minimal about it afterwards, and they'll get kind of reactionary hyperpigmentation, and we'll talk about that later. Do they pick or peel at their skin? Picking and peeling is normally an unconscious thing that we do. It's kind of like itching a scratch. You don't really realize you're doing it, but it itches, it feels funny, you react to it, right? However, you cannot do that while peeling at all in any way, shape, or form. You will greatly increase the risk of scarring, both texture and hyperpigmentation. And if clients are heavily peeling, the best thing you can do is suggest that they get those teeny tiny little shears and just trim the peeling skin. If they're like, yeah, I don't trust myself with scissors that close to my face, that's fine. They can just let it hang out. But they cannot pick it, they cannot peel it, they cannot remove it. If it is already hanging from the skin and they've got like a lot of it, they can very gently kind of press what's still connect it to the skin on and roll the excess away. Even then, I don't suggest doing that. If you're gonna remove it, go the crane shear method, or just wait until you can use a washcloth, really. Do they use sunscreen every single day? I know we discussed routine and using it every single day. It bears repeating, okay? This, a lot of times, makes the difference between a successful peel and one that turns just gnarly. Sunscreen usage is vitally important leading up to and during the healing process. It's important to maintain it afterwards. It's very important to maintain it afterwards. You will get some people who, they're like, yeah, I really will only use sunscreen if I'm going to be outside for like more than 15 minutes. And then, you know, I'll use it and I'll make sure to reapply. Use your best judgment with those clients. I leave it in your hands. I've had some clients that I'm like, yeah, you'll be fine. And I've had some clients where I'm like, you need to use it every single day. Or I can't guarantee the success of it. It's really gonna depend on a lot of different things. What kind of downtime are they comfortable with? Many of our peels have 0 downtime or very minimal downtime, so minimal peeling. Something that they can heal from over a weekend. Some are a bit stronger. Some are so strong they might actually, you know, want to take a little time off work. Now, if they're okay with peeling at work, then that's fine. But for some, they might want to take some time off work because their skin's going to be red, irritated, sensitive, and peeling. There are some people who are going to have to take time off work if they work in an especially hot environment or if they work outdoors. You're going to have to take time off work during that healing process in order to make sure that we don't get reactionary hyperpigmentation, because the skin is irritated. We introduce heat, we introduce UV rays. It's going to create way more inflammation than needed and cause inflammatory hyperpigmentation. So gauge how much peeling they're okay with or what works with their lifestyle before you pick out a peel, right? Are they okay with making some adjustments to their routine? Retinoids need to be discontinued for at least a week before peeling. Bioretinoids are fine. They can use bioretinoids, no problem. But retinoids need to be discontinued. Now, if they're using something really gentle, like a retinol per se, you can, you know, gauge that to about 3 days beforehand and they'll be fine. If they're getting prescribed something on the other side, a week, maybe even 10 days, just depending on the depth of the peel. Most retinoids, you're going to want them to stop a week beforehand, and most clients are more than happy to oblige with that. They'll need to decrease their exfoliants at home to keep the peel from going too deep. And this can be done, again, depending on the depth of the peel and the client, anywhere from, 48 hours ahead of time to a week or more ahead of time. Really just depends on what they're using and the client and the peel you're going with. No exfoliating masks. Hydrating, soothing, calming, those are all fine, but no exfoliating masks for, again, about a week beforehand. You'll want to keep these adjustments for at least 8 days following the peel as well. And you'll want to keep those adjustments until you're done peeling. I say that because you have like those weekend peels, right? You'll have, fresh skin in about 48, 72 hours. But you'll want to keep that calming, soothing routine for up to 8 days. We'll have some peels where they're peeling past the 8-day mark, but we don't want them back on more aggressive exfoliants yet. Keep them on that calming, soothing routine until the peeling is done, and that's the case. So it's either 8 days or when the peeling is done, whichever is longer. Will they properly prep their skin? Now, we recommend a couple major things to prep the skin. We recommend they start taking both glutathione and Heliocare roughly about 6 weeks before starting chemical peels. Neither of these will interfere with any medication or any treatment, but we do recommend they still talk to their primary care physician just to make sure. Because the last thing we need is for us to say, oh, it's fine, and, you know, turns out they're allergic to it or something. Glutathione is an antioxidant that helps the body with combat effects of oxidative stress, which is something everyone experiences, right? So it's not like this is just geared for skin. This is geared for chronic inflammation, chronic pain, things like that. And everyone will experience different levels of oxidative stress depending on environment, diet, aging, any chronic illnesses or conditions, things like that. It is also a tyrosinase inhibitor, which means it combats hyperpigmentation at the cellular level. This is going to be super important, especially for in the healing phase, to keep them from getting reactionary post-hyperpigmentation. Heliocare is a supplement that the dermatology side often gets. I try to keep a box in the room. They have little sample packets, so the appointment before they see you for a peel, have them get one of those packets. It'll come with a coupon. They can go right to Walgreens and get it there. It's basically like SPF from the inside is the best way I know how to describe it. It utilizes the Polypodium leucotomos. I'm gonna hope that's the way to say it, fern. It's from Central and South America, but it is full of antioxidants which neutralize free radicals, which particularly target sun damage. Dr. Florentino, you know, is very healthy, but she's not into a whole lot of woo-woo stuff. So the fact that she has this means that, no, this is serious business. She recommends it a lot for her skin cancer patients, for those who are very prone to skin cancer. It's not going to hurt anything, again, as long as they're not allergic. And it does nothing but help. So definitely recommend our clients take both of those. Both of them together will help prevent that reactive post-inflammatory hyperpigmentation, a problem where clients have darkening after a peel, usually due to inadequate sun protection. So these paired with sunscreen and a hat when possible will combat that and lead to a much more effective peel. We also recommend lots of electrolyte water to help hydrate you the best you can be hydrated. A lot of our clients, myself included, aren't the biggest fan of just plain water, and so getting those electrolyte packets, adding fruit to electrolyte water, both are really, really helpful in getting a good amount of water down. I don't like to give like you have to drink half your body weight or this, that, and the other, because a lot of us also get a lot of water in the things we eat. But around 64 ounces a day is normally a good amount for pretty much everybody. And then that's also going to help make sure that the skin the skin is prepped from basically the inside out to be hydrated enough for the peel to go where it needs to go. If it's too dry, it's kind of like painting water on one of those dried up kitchen sponges. It's gonna go down a little bit, but it's not gonna get down to that level where it needs to in order to do its best job. So for our chemical peel services, we have light medium, medium, and medium deep. Just depending on the peel itself, how we apply it, things like that. We tend to start lighter and can go deeper as time goes on until you get the results you're looking for. For a peel series, it can look like starting with 1 layer, right? Moving to 2 layers for session 2 if they really tolerated 1 layer well and want to give it a little extra punch. let's say they tolerate that really, really well and you feel like you can give it a little extra nudge in the right direction, we can go for 3 layers for session 3 and 4 if that's tolerated really well. If we have a history with that client, you can start a little stronger. Like, let's say, for instance, this is their second chemical peel series with you, right? Like, you did a chemical peel series with them in the spring. They tolerated that really well. You got to 3 layers of, you know, a Jessner's blend peel. They did great. They loved it. In the fall, you can probably go ahead and start with 2. I wouldn't jump right in with 3, but you can probably skip that 1 layer step. Now, unless something has really drastically changed with their skin, in which case, yeah, you might want to start with that first layer. Just see how that goes on its own. But normally when they've got a history with us, it lets us bump up that starting position just a smidge. So that's always important to consider. Keep in mind that, especially if you're doing peels with them in the spring and fall, summer's a big season. You will have some clients who unfortunately will go in the sun, not be as diligent about their sunscreen, and so in the fall you're trying to treat all the damage that they did during the summer. If you notice that's what's happening, stop with the peels. Just stop with the peels. It's not worth it and it's going to do more damage. Recommend something like microchanneling instead for whatever it is you're trying to treat. But don't put that on your plate. Like, they're not going to listen to proper home care. It's not going to be something you want to deal with. It's not going to be something we want to deal with. You will have clients like that. It happens no matter what. Now, the trend is more and more leaning towards don't be dumb, put on sunscreen. You're still going to get some of those clients. It's how it works. So, on to the actual protocol. All right, so room setup. Start with your bed. Now, some of our peels you can utilize actually as an add-on in a facial, and we will go over those in the actual training videos for those individual peels. We're treating this as the chemical peel service, right? This is not your, you know, relaxing, calming, soothing facial. This is chemical peel treatment, okay? They're not expecting something relaxing. Don't really prep them for something relaxing. Prep them for the treatment, okay? You'll prep the bed in the room for what we call an above the covers service, meaning they're not going to disrobe, they're not going to get under the covers. You can provide an extra blanket for them if you feel like it's going to make the room more comfortable. We do keep the rooms pretty chilly, particularly this one. However, most of them will find that once the peel is applied, they're not really going to want that blanket unless they are just very, very cold natured. In the really, really coldest months, you're still going to want the blanket though. Turn on the bed warmer to about a 2 or a 3. You're going to place your bottom sheet, your top sheet, and the comforter. You will turn up the comforter and the top sheet at the foot of the bed if you want. If you do that, please make sure they take off their shoes so you're not trying to, you know, sweep dirt from the bottom of their shoes off the bottom of the bed. Otherwise, you can just leave it folded down. This we'll get into in a minute, but this is going to look a little different. Go ahead and prep your barbicide. That's a 1:8 ratio, so 1/4 cup of barbicide to 2 cups of water. Plug in your ultrasonic machine. Do the enzyme cleanser. That is, I think, 3 to 4 cups of water to a 1.5 tablespoons of enzyme cleaner. I've got it written down in that cabinet, but double check. Plug in the ultrasonic machine. Just make sure all your stuff is prepped. Do your hot water kettle, all that good stuff. So your towels, your under the head towel, your 1 large white towel. lay this at the head of the bed like normal, but it's going to be on top of that comforter. You're not going to fold down the sheet and comforter like this. It's going to be on top. I will make sure I get some footage of what that's going to look like. But it's going to be on top because, again, you don't want them getting under. They're going to lay on top. You're going to want 3 of the blue-gray towels. One of these will go at your workstation. Don't laugh, I call it a Mise. It's kitchen terms, professional kitchen term for mise en place, which means everything in its place. It's how you set up your workstation so everything is in its spot. It's quick and easy to work from, and you've got it solid. You don't even have to think about it. So if you will hear me use Workstation and Meez interchangeably. If you hear me say Meez, that's what I mean, okay? So one of those is going to go on your workstation, your Meez, whatever you want to call it. The other 2 are going to drape on the client's chest like this, and I'll show you what that looks like. After they've laid down, so you'll want to set those aside. You will want 1 gray towel to wrap their head up, just like you do with all the other facials. Then you will want 2 of the smaller white towels. It's going to be for removing your cleanser and your Theraderm. And then you'll want 2 of the purple towels for cleaning up afterwards. Now your workstation. Here's where things get interesting. So, figured I'd go ahead and show you. You got it like this. Instead of folding it back, you keep it all up. White towel down, and you'll want it about the same positioning that you would have in a regular facial, so you want some of that hang down here in the back. And then your head drape towel. Now, for 2 of the gray towels, kind of refold them so they're a long way and do this number. This is the best way to drape for a chemical peel. It's going to make sure that you get everything covered that you need. Now, if you are adding on the neck and the chest, you might have them disrobe for that and put on one of the drapes. It will still be an above the bed service, okay? Just have them disrobe their shirt and their bra so you can access any of the décolleté that you need to. Again, that is an add-on, okay? We don't automatically do that. That is an add-on. But you will have some people who want to do that, and that's totally fine. We can do that. Draping for that, though, you wouldn't really, because they'll be draped in their little drapey number. How many times can I say drape? So, we're now going to pretend that this is your workstation, right? I normally have my towel folded about like this, just to give me a sterile space to work off of. So here's what that's going to look like. This is going to look really similar to your Meez when you've set up for a facial, but there are some key differences. You've got your hot water bowl, 2 sponges in here. It's ready to fill up with hot water when it's ready, okay? You've got your tool packet. You'll be using the tweezers, the microderm tip, and the dermaplane handle. Do not try extracting on a peel day, okay? Unless it is one of those very, very light peels that you do during a facial. Again, we'll kind of get into that protocol when we talk about the peels you can do that with. But in general, don't extract on a peel day. It's just, it's not fun. If you whip up your second cleanser, I highly recommend it. You'll need a bowl and a brush for that. And a bowl full of cold water. See if you can get some ice. Cold water with 4x4s, okay? Since this service is above the bed, we go for a little bit of a different feel than a normal facial where we've got all of the mood lighting and the super serene music and we're just trying to lull them to sleep basically. We're not trying to do that here, okay? In this room, you can turn on the fairy lights behind the curtain. That's totally fine. But keep your overhead lights to about medium or even low, you know, once they've gotten in the bed, and that way you can turn on your headlamp and see what's going on. If you want to turn it off so you have more light from your headlamp, that's up to you. That's totally fine. You can use the spa playlists if you want. Not a big deal. I tend to do like a lo-fi playlist. It doesn't quite put them to sleep. It relaxes them, but it's in general not going to put you to sleep unless you put on one of those playlists that will. In general, you just kind of vibe with it. It's fun, it's chill, it's cool. But it kind of reinforces we will make this as relaxing as we can, but you are not necessarily here to relax or to sleep. Get your diffuser going with your oil or blends of choice. We will be adding some more of those soon, so that's exciting. Now, before you continue, one of the biggest parts of a peel that people often mention, way past it, right, is they don't realize just how much of a difference that peel, or particularly peel series, made until they happen to be looking at pictures before they got that peel and after that series is done. And then they're like, oh my God, this is crazy. I had no idea it changed that much. Well, we could see it, and sometimes we even forget how much the skin has changed. We know there's a difference, but it helps everybody to kind of gauge just how successful it was. So it's important to take pictures the day of before applying the peel. In fact, I like to do it as soon as they've laid down, before I even take off any makeup or anything like that. You can do it once you've taken off makeup. You can do like one before makeup removal and one when you're like doing your analysis, basically. That's totally fine. But especially if they're doing a peel series, you'll want it to, you'll want to get one, that first treatment before you remove their makeup, one after you remove their makeup. Make a note. Normally in like your camera, there's a place where you can make little notes of like, what am I trying to say? There's a place where you can normally make notes by the photos, not necessarily in them, but like when you took them, right? So document before makeup removal, day 1, after makeup removal, day 1. And then, you know, peel 2, peel 3, peel 4, and then at your follow-up, okay? Those are all going to be so important, so you and the client can see just how far their skin has progressed. Because you will get some clients who are like, my skin didn't make that much of a difference. Like, I don't know why I paid all this money. And you'll be able to look and say, no, it actually did. Here's what it looked like at the start, and here's what it looks like now. You're having a little bit of skin amnesia. Don't say that though, they get mad when you say that. So, now the protocol. For the peel protocol. It's a pretty exfoliating prep, so just get ready. You are gonna start with our tried and true beloved oil cleanser. Dry skin, dry hands, work it in, and then emulsify with water. If you really want to get in and make sure their skin is extra squeaky clean, you by all means use the BT Sonic with it. This whole thing can be immersed in water so you can get it good and clean, no need to worry. And then feel free to remove it again once you've emulsified with water. with this guy, the ultrasonic spatula. Make sure it's on the cleansing setting, and you will want it going like this against the skin, okay? What that's gonna do is those ultrasonic vibrations are going to kind of push everything that might be hiding in those pores. Not quite, you know, extraction level, but definitely dirt, makeup, debris that's hiding in there, things like that. Push it out of the skin so we're getting it as clean as we can. We don't want that peel having to fight through anything. Next, you do the exfoliating cleanser. Now, when I do the exfoliating cleanser step, I always whip up whatever cleanser I'm using with the powder and a little bit of water, with powder being either the Stone Crop Visifoliant or the Strawberry Rhubarb Dermafoliant, okay? I always whip that up. There is some rice flour or rice powder in there. It makes a really nice frothy foam. So you don't feel the grit quite as much, but it is still very exfoliating. You're still getting the exfoliating benefits. It just feels texturally a lot nicer on the skin. Use whatever technique you want. Whether you whip it up, whether you don't, it's all going to be very exfoliating by the time we get to the peel. So don't let it freak you out if, like, let's say you're whipping it up and it's not quite getting to the frothy stage. That's totally fine for this. If you've gotten it a little more frothy than you want, don't let it freak you out. Don't feel like you gotta start over or add in more powder. You'll be fine. Next, you want to do peel prep. Now we're actually going to do this in 2 rounds, okay? The peel prep solution is from Institute Dermed. This is a triple acid blend. A Jessner's peel, not really a Jessner's peel, because those start normally at about 15%. But this is lactic, salicylic, and glycolic, just like a Jessner's peel. But it's obviously much, much more diluted, okay? It's also in an alcohol base. Again, very similar to a peel, but not quite. What we're trying to do with this is dehydrate that top layer of dead skin so it comes off much easier, as well as dissolve the bonds between those dead skin cells. So again, they come off easier. This also kind of go ahead and starts pre-treating the skin. It's got some sugarcane, lemon, apple, and green tea, as well as some witch hazel. Okay, so it is antibacterial, but it's also a bit soothing, which is going to be really, really nice and important. Kind of does a little of the soothing anti-inflammatory work to keep that inflammatory hyperpigmentation from happening right from the get-go. You're not going to want to go too hard with this, just however much you would normally use for prepping for a dermaplane, because we're going to go hard with this later. I'm going to want to go ahead and tweeze. Normally they've come to see you about 4 weeks in advance of this. Sometimes it's as much as 6 or 8, depending on scheduling. So go ahead and tweeze. Then you will dermaplane with no oil. This is vastly different from how we normally do it. If you want more, more experience doing that, if you feel like you're not quite comfortable with doing that, let me know and I'll help you out with it. But you really are going to want to make sure you dermaplane with no oil, okay? We want to make sure that the peel is fighting through as little as possible to get the job done. Once you are done with that, their skin is going to look a lot more irritated than normal. That's okay. That's okay. That's to be expected when you dermaplane with no oil. You're going to want to spot microderm anywhere where you really want to make sure the peel hits, or anywhere you couldn't really dermaplane that well. Go ahead and spot microderm that. Again, no extractions. Just don't do it. It's not fun. Even when the client comes in for an acne peel and they've got active inflamed acne, I really discourage any extractions that day, because it's gonna be miserable. It is gonna be miserable. You don't want to do that on them if you can in any way avoid it. There are some instances where, like when we do our flash peels, and we'll get into those protocols on the peels that it works for, where it's okay, you can do that. But for this kind of service, don't do that to them. Oh God, don't do that to them. Once you've spot microdermed, we will use our lovely friend Theraderm. Use your normal amount with this. I suggest letting it sit for about 30 to 60 seconds before you roll it away. That will help make sure that you're not over aggravating that skin right after you've dermaplaned it, because it's going to be a bit more sensitive than normal after a dermaplane, after our normal dermaplanes. You'll remove that with a steam towel, and then I would suggest going ahead and hitting the skin with a fan to try and dry it out some, because then you're going to use the peel prep again, and it stings a bit more when there's water left in the skin. So after you get that, honestly, I would do like a cooled off steam towel. Let the steam towel sit in there probably until you get your steam towel out to remove the exfoliating cleanser, and then go ahead and put the other one to the side. Let it cool off before you use the Theraderm, before you go with the rest of the service. And that way when you remove the Theraderm, it's going to be nice and cool to them, because they'll be a little aggravated from that oilless dermaplane. Dry out their skin with the fan for a bit. It should dry out pretty easily. And then you're going to want to use the peel prep again. You're going to take a 4x4 with that peel prep, and you are going to scrub. Okay, you're going to do about 8 to 10 passes in small sections. Just scrub. Okay, we are trying to make sure that we get any little possible bit of that top skin dehydrated, ready to go for that peel. Okay. We've done some of the peels work for it, and that it's not having to fight through the dead skin on top. Okay, we have prepped it and it's ready to go, but we still have to dehydrate that top layer for the peel to really get in and do its job. So you're gonna apply your occlusive where you need to. I always recommend the little doe foot applicators, and my favorite occlusive to use is the Uli's Ointment All-Purpose Balm. This is a beeswax and olive oil balm. It is super gentle, very minimal ingredients. They're likely not going to react to it. Okay. Apply it around the nostrils, on the lips and along the lip line, and along the lash line. Okay. If they have permanent makeup, slather it on those areas so the peel does not get there. Okay. If they've got microbladed brows, powder brows, things like that, slather this stuff on. It will help protect those areas so they do not get hit with the peel. You're going to dispense the appropriate amount of your peel. That is normally 10 milliliters. And you can dispense it in one of these guys. Now, how you apply it is really up to you. You can use a fan brush, you can use a 4x4, you can use gauze. I don't recommend the little sponges, they don't work quite as well. I honestly normally use a fan brush because at that point I don't really need to scrub the peel into their skin as much. We've already done a lot of that exfoliation removal for them. But do make sure that they are holding, that the client is holding the fan so that way they can fan themselves as the peel is going on, because it is going to sting. It's going to be a little bitey. Let it sit for the allotted time. It's normally around 8 to 10 minutes. As we get into the individual peels, I will let you know timing, like specific timing, depending on how deep you're going, adding layers, things like that, but it's normally about 10 minutes, okay? Then you're gonna neutralize. You will grab your ice cold 4x4s. If we have it, spray some of the soothing chamomile tonic, just a spritz or two on each 4x4, and squeeze out the excess water, spray, and then go ahead and wipe down, okay? You want to be very gentle. In fact, depending on how many layers you've done or how sensitized they're looking, you might just want to lay it on their skin for the first round of neutralizing and then remove them. And then after that, you know, you can swipe with more 4x4s. Most of these peel, we tend to get peels that neutralize with water and thyme. So just wipe down with water, wipe down with water, wipe down with water. That soothing chamomile tonic will help a lot. Don't spritz it directly on the skin. That's too much. But do spritz it onto the 4x4. It helps dilute it enough, and then swipe it on. Take breaks in between neutralizing, you know, like lay them all on, take them all off, ask if they still feel burning. If they do, where it is. Or stinging, however you'd like to phrase it to be not scary to the client. And swipe those areas. Sometimes it's all over the face. That is totally fine. Swipe, 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 swipe. Take a little break. Are you still feeling any tingling? I still feel it along here and along here. Okay, swipe those areas. Are you feeling any more tingling still? Just keep doing that until there's no more tingling, and then you're good. You have officially neutralized. How to finish. This is all hydrating steps, okay? You're gonna tone. You're gonna use any serums. I like to do the green flower peptide serum. I like the kombucha serum. I like the strawberry rhubarb hyaluronic serum. Really just depends on what it is we're trying to treat. Use any gels or concentrates you think will help. The bamboo firming fluid is a great one, and especially if you're doing aging, both the bamboo firming fluid and the lavender age corrective concentrate are fantastic. Use a little bit of oil. Okay, this is a great spot to use the facial radiance oil, which is chock full of anti-inflammatories, antimicrobials, soothing, hydrating, calming components. And you can add in some of the Ola oil from Uli's ointment. This is full of anti-inflammatories, absolutely chock full of them. You can do, you know, a little bit of each, combine them both. They combine really easily. Just swirl them in your hand, pat them in the skin. The skin is really going to appreciate that anti-inflammatory punch in the healing process. Put on whatever moisturizer you think is going to work best for them. What just happened? Lighting changed. Put on whatever moisturizer you think is going to work best for them. You can even do the kombucha leave-on mask. That one works nicely. The Clear Skin Probiotic Moisturizer for acne skin is great for after a peel. Kind of use your best judgment. You're going to want something that's a little more occlusive than you might normally go for with them. You use your eye product, and you will use sunscreen. Go ahead and put on like a little more than you might normally, or you can even double layer your sunscreen if you want to do like a layer of the Liloquoi sunscreen, pat that in, and then pat in a little of the radiance fluid on top. Totally fine. You can definitely do that. Now we get to aftercare. You finished the service. Everything's good. Everything went great. And now what? Now what do we do? Well, you've already established the routine. That's going to be the biggest part, is them keeping that calming, soothing routine that you started them with, that you prepped their skin with before them coming in for the peel, and make sure that they are only using products approved by you. Okay, if you think they might deviate, go ahead and try not to give them your personal cell phone number unless you think they won't abuse that, because some clients definitely will. Always feel free to, attach your professional Instagram or our Instagram, our Facebook. Totally fine, or just say to call here if they have any questions, and we can always forward any product issues to you. But keep their routine to those basics for 8 days until peeling stops, whichever is longer. That's the biggest thing. That and sunscreen. As long as they do both of those things, take the glutathione, take the HelioCare, they're going to have a really successful, beautiful peel. And then it's a matter of booking the follow-up appointment. You'll go up to the front with them. I would suggest saying, hey, I'll meet you up front. I'll be right back. Do grab them a water bottle, okay? I know it's not a normal facial. However, we're causing a lot of stress to the skin, a lot of dehydration. It's really important to reinforce that they need to drink a lot of water during this process. So go ahead and grab them one of the water bottles. Totally fine. And then right then and there, book their next appointment. If you're doing a peel series, have them come in once every 2, 3, or 4 weeks, depending on the peel you're doing. We'll talk about that when we get into the individual peels. Some of them you can do, honestly, as soon as weekly. Those are the ones that we tend to incorporate into the full-length facials. But, depending on demand, we might be able to, make that its own appointment. Normally, we suggest 2, 3, or 4 weeks, just depending on the peel and what it is you're trying to target. Otherwise, schedule them to 4 to 8 weeks out for their next facial, whatever is their normal. If they are an every 4-week person on the dot, go ahead and get them in 4 weeks. If they are, every 6 to 8, get them in closer on the 6th side if you can. If not, 6 to 8, whatever works. And be prepared to take after photos and then immediately compare on the spot. You'll want to have them, whether you take them on the iPad or you take them on your phone, you'll want to make sure that they are in their own album, that client has their own album, okay? And then they can flip through and see, this is where we started, before removing makeup, after removing makeup, and that's what I look like now? What? It did make a difference. So that is really, really important to do that. Now, main questions and concerns. Frosting, okay? You hear a lot of people say frosting is really bad. You don't want frosting, this, that, and the other. For some peels, that is the case, but 9 times out of 10, it is totally fine, okay? Frosting will look like little white dots of, frost or ice almost on their skin. That means that spot of skin has taken as much peel in as the skin will let it, which is great. It means if you're doing multiple layers, that you can avoid that spot. You don't have to go back over that spot. That spot is packed to the brim with peel. Focus it elsewhere. If you are doing one layer, that's also great because it means that skin is properly utilizing that peel. So either way, it's a good reaction. Don't let it let you freak out, okay? Another issue is, can you layer different types of peels? Yes and no. I don't recommend layering different brands. That's not necessarily a good idea. Different brands formulate their peels in different ways to where, in one brand you might be able to layer adjusters in a TCA peel, but that doesn't mean you should layer a TCA peel from another brand with brand A's Jessner's peel, because it might not react to the same. Those two are different TCA peels. They're not necessarily going to play the same way with that Jessner's peel. So any layering or cocktailing of peels, stick within one brand. That is going to be where you have your best results. And I will give you kind of all those recipes in another video. But do know, like, if you've got someone who's really peel resistant, like you're using a 20% TCA peel, which makes most people peel, and they're like, yeah, I'm not getting anything. There are ways that we can amp that up even more than we already are. Just know that most people aren't going to be like that. There is, however, something else to consider, which is more and more peels are being made to where you don't shed your skin like a snake anymore. More and more peels are meant to give you the same results as those incredibly deep peels without the same downtime. Whenever we hear lower downtime, that means less peeling. It doesn't mean the result is going to be bad, and it doesn't mean it didn't work. A lot of clients will assume if they did not shed their skin like a snake, then it didn't work. And that's one of the really important parts of before and after photos. We will most likely be getting a 35% TCA peel in the Bio Repeal. That is specifically made to where you do not peel. You need to use it on a client who understands that they are getting the results of an incredibly deep peel without the peeling effect or very minimal peeling. Okay? If they don't understand that, they're going to think they wasted their money because they're going to think the peel didn't work. So it's really important to work with your client and have them understand that just because a peel doesn't make you shed your skin like a snake, or you have minimal peeling, that doesn't mean it didn't work. Okay? It just means your skin didn't need to peel like that. Okay? It means it's actually a pretty good thing. Okay? It means they're getting a lot of good exfoliation at home, the proper amount. It means that we did our job to thoroughly prep the skin, and it means that the peel isn't focused so much on shedding extra layers as much as it is actually treating the skin, which is really the whole point of what it is we're trying to do with a chemical peel. So if your client is looking for, like, I want to shed my skin before winter, and you know that if they don't shed their skin like a snake, they're not going to be happy, there are some peels that we can do to make sure that will happen. But note, you're not going to want to bring them in for one of the other peels that are made to have minimal downtime, because they're going to think it's a waste of money. Unless you can level with them and be like, look, that's actually not how this works anymore. That's how it used to work. That's not how it works anymore. So a lot of things to keep in mind. If you have any questions, any concerns, anything that you're like, okay, I think I get it, but not quite, please feel free to reach out to me. But yeah, that's Chemical Peels 101. I know it's a lot, but I know you can handle it.